Good morning, everyone. Today we are reporting 58 new cases of COVID-19 in the state. This does include 10 new hospitalizations, 5 new deaths. Those deaths occurred among Minnehaha County residents. We have 82 individuals who have recovered from COVID-19, as well as 336 new negative tests that have been performed. In total, we've had 2,779 COVID-19 cases in the state. We are at 773 active infections and 1,977 recovered individuals. In total, we've had 230 hospitalizations and 29 deaths. Total negative tests that have been performed to date include 16,637 tests. There are no updates for the community impact map today, and the cases by county include 1 in Brookings, 5 in Brown, 2 in Day, 2 in Grant, 6 in Lincoln, 36 in Minnehaha, 1 in Moody, 1 in Oglala, Lakota, 1 in Roberts, 1 in Todd, 1 in Turner, and 1 in Yankton. For cases by age range, we have 7 in the 0 to 19 year age category, 7 in the 20 to 29 year age category, 9 in the 30 to 39 year age category, 11 in the 40 to 49 year age category, 8 in the 50 to 59 year age category, 10 in the 60 to 69 year age category, 1 in the 70 to 79 year age category, and 5 in the 80 and older category. For cases by sex, we have 37 that are male and 21 that are female. For the deaths by county, we have a total of 2 in Beetle, 1 in Gerald, 1 in McCook, 24 in Minnehaha, 1 in Pennington. For deaths by age range, we have 1 in the 40 to 49 year age range, 4 in the 50 to 59 year age range, 5 in the 60 to 69 year age range, 4 in the 70 to 79 year age range, and 15 in the 80 and older population. For deaths by sex, we have 16 that are male and 13 that are female.
Okay, and with that, we'll start to take questions.
JP from KORN Radio.
Go ahead, JP.
Thank you very much. Could you give us an update on how many additional tests were done in Sioux Falls on Tuesday?
JP, this is Kim Alsam-Risden. I don't have the exact number, but it was over 1,000 tests were conducted as part of the mass testing event on Tuesday.
Very good. And one other question, can you give us an update on the number of recovered cases from Smithfield employees?
So we have 772 individuals who have recovered that were COVID-19 cases that had Smithfield as an employer.
Thank you.
Next question.
Yeah, this is Trevor Mitchell with the Argus Leader.
Go ahead, Trevor, with the Argus.
So we were told on Monday that this mass testing event, those results will take roughly 48 hours. Should we expect to see the results from that show up in tomorrow's updates around when the website updates tomorrow?
Yeah, we'll start to see the first day's results show up in tomorrow's report.
Okay.
That'll just be the start of it, though, Trevor. We might not have the full day's results in by the time that we run that.
Right, but tomorrow we'll start to see some of the impact from that testing event.
Yes, that's correct.
Okay.
Yeah, with the focus that we do, cut the data at 5 p.m. the day prior to help inform where we're at in the current days, or today's numbers, as an example.
Thank you. Next question.
This is Scott Waltman up in Aberdeen at the American News. Just coming kind of the daily inquiry into the number of cases tied to that are beef plant employees up here in Aberdeen, and then would it be correct to say the rest of them come from more general community spread? I guess I just wanted a little clarification there.
Certainly. So we have 44 individuals that are COVID-19 cases associated with the Demcota beef, and you are correct that the other cases that we're identifying, have not been specifically tied to any individual large exposure at a business or within the community. So would be identified as community spread.
And the 40, just to clarify, are the 44 tied to the beef plant or all workers at the beef plant?
The 44 are specifically employees of the beef plant.
Okay, thank you.
Yep.
Next question.
This is Joseph Barkoff from the Capital Journal.
Go ahead.
Good morning, y'all. I was curious if you guys are tracking and perhaps even releasing the numbers of the Smithfield close contacts as to how many have recovered. Will that be something you guys release?
So we have 245 individuals that are close contacts to Smithfield cases that have themselves become cases, and 222 of them have recovered.
Sweet, thank you.
Next question.
This is Morgan at the Rapid City Journal.
Hi, Morgan. Go ahead.
Kim, I just want to refer back to what you said last week about the testing, that we're currently at 3,000 and we're going to go to 5,000. And I kind of wondered how the mass testing at Smithfield would factor into that and the timeline of how that will increase.
The Smithfield, the mass event there is just kind of part of our overall operation. And so what we're planning on for lab testing capacity across the state, including the public health lab, labs that are located and associated with our healthcare systems in the state, as well as outside commercial labs, is that we have the ability to conduct 3,000 tests a day today, and we anticipate that will increase to 5,000 tests per day. I don't have the time period of when we will, when we have that 5,000 test marker. We're still working through that, but the mass testing that's happening would just be kind of averaged into the total.
Okay. Thank you.
Next question.
Yes, Beth Borden with Dakota News Now.
Hi, Beth. Go ahead.
Yes, with the 3,000 tests per day initial goal, how many days in a row are you able to sustain that? Is that just one day or multiple days, and how many?
So Beth, that's we anticipate being able to sustain that as long as we have that need.
Did you have any follow-up? Are you okay?
Yes, could you tell me where you are getting your supplies from? Is it multiple sources or one source?
So are you speaking specifically about the State Public Health Lab?
What you are overseeing. So if you're just overseeing the State Health Lab, then that's the question. If you're overseeing all supplies for the entire state and supplying those testing supplies, it would be for every entity.
Okay, so let me just explain how it works relative to lab supplies. So obviously the state runs the State Public Health Lab, and so we get supplies to run the tests that we would be processing there. We also get allotments of testing supplies that we can distribute to individuals that are conducting tests. And so there's a couple of different answers to your question. The other thing that I would just point out is that there's different types of lab testing. So there's different machines that are used, across the state, whether that's at a clinic setting, a hospital setting, the state public health lab. So where we get the supplies is a varied number of sources because we have different equipment that's out across the state.
Okay. Next question.
This is Morgan again.
Go
Can you
ahead.
hear me?
Yep, go
I
ahead.
just want to talk about the cases in like Oglala, Lakota County, and Todd County, and some of those others that, are those connected to community spread on the reservations there, or can you talk to that?
That is not information that I directly have at this point. A lot of times our staff are still actively investigating those cases in order to help determine, whether or not it is associated with someone else, that they may be close contacts that have been tested, or whether it truly is community spread. So I don't have any updates specifically to those counties. And that information is reflected on the community impact map, so that if we do have cases that are community spread, and that applies for Oglala, Lakota, Brown, Todd, any county in the state, that is updated. So when we reach the number of at least one, that we transition from no community spread to that minimal to moderate. And then when we have 5 or more active cases, we do transition to substantial spread. And then obviously the step down from that is when we have no active cases, moving back down to that minimal to moderate. And then after 28 days following the last case being released from isolation, we also step down from that minimal to moderate to no community spread. So information is not often provided at an individual case level, but you can always check that community impact map for what is happening within the county.
Okay. Any other questions?
Yeah, JP at KOR News Radio again.
Go ahead, JP.
Thank you. Is it safe to say that it's likely we'll see a surge in positive as well as negative test results over the next several days? And what would be your advice in how the community should react to the increased numbers?
Well, JP, this is Kim. I'll start, and then Dr. Clayton can add some more detail. But yes, we do expect to see more positives when we do more testing, and that's been the history of how this has worked, and this is what we would expect when we see a lot of tests being performed. I would, we'll be working as we do with every single positive case so that they understand what they need to do to keep themselves safe and keep others safe. And so that work will continue with the contact tracing. And, we would just want people to continue to do what they can do to keep themselves safe, practice social distancing, good hand hygiene, don't go out if you don't need to, minimize your contacts with other people, and COVID is in our communities, and so we need to just keep that in mind and not overreact, and certainly not stigmatize people that have it. COVID will strike anybody, regardless of what their situation is.
And I think the one addition, that I would make is that the personal precautions that individuals take for COVID-19, as the Secretary had mentioned, really should be in place already within the community. Both Minnehaha and Lincoln counties are considered at substantial transmission. So any additional positive cases that are identified does not really change an individual's precautions that they would need to take in order to protect themselves.
Thank you.
Was there another reporter that was chiming in at the same time JP was?
Yeah, this is Alex with the Black Hills Pioneer.
Okay, go ahead, Alex.
Hi, thank you. With the increased number of tests that are available, 3,000 per day, and hopefully we're getting to 5,000 per day, does that mean that everyone who's calling in with symptoms is getting tested?
Well, Alex, the determination of who gets a test is made by the provider, and so there's usually a process where the person who has a question about what their situation is, they would contact their provider. The provider would walk them through either a protocol or some kind of symptom checker, and then work with the individual on a case-by-case basis on their next steps.
Okay, so if sick people are not being tested, are these numbers that we're getting from the data collection accurate?
Well, it reflects who's getting tested, so if there's people that aren't getting tested, that obviously would not be part of the data.
But there again, the individual is, not just able to get a test, if they want a test. The focus is on, that is a discussion among their medical provider to make sure that testing is appropriate. There may be other testing that is necessary. We have other circulating respiratory pathogens, and so sometimes it is helpful to also do additional testing to identify what is the cause of the underlying symptoms. So that is the reason for that medical consultation.
Okay.
Thank you.
And we'll take one last question, if there is one.
Jeremy Dukenberg, Forum News Service.
Okay, go ahead, Jeremy.
Hey, yeah, so just kind of a follow-up to that, actually. So the state sent out new guidelines last week for testing, and my understanding was that seemed to kind of loosen up what some of the guidelines were. However, I've heard from several healthcare providers who said that the new guidelines are actually raising the bar for testing, both slowing down the assessment process and limiting the number of people who get checked because the symptoms require, respiratory symptoms require providers to check for heart attack and that kind of thing. Are you concerned at all about that limiting how many tests are actually, or how many specimens are being submitted for testing?
Well, Jeremy, this is Kim. I'll start, and then Dr. Clayton will add some more detail. But the criteria that the CDC have put out that we forwarded on last week actually expand the list of symptoms that would be indicate appropriateness for testing. So we don't see it as limiting. We see it as expanding the number of people that should be considered for tests.
And yeah, the CDC, based on additional information that they had on cases that have been reported to CDC, used that to more actively focus in on individuals that had a higher likelihood of developing, whose symptoms may have a higher likelihood of them actually being positive for COVID-19. And so that is the reason that the focus has de-emphasized a little bit the focus on fever, and the two primary constitutional symptoms are cough or shortness of breath or difficulty breathing. And then the list of other symptoms that are listed in there is a 2 or more list, and that list was expanded for individuals in order to be tested. So there again, I think that does help loosen the criteria that are used to help aid medical providers in their evaluation of patients with symptoms.
Okay, thanks.
Thank you, everyone. That's all we have for today.